Hung. Thank you. So Mario is a patient research partner and champion of the Alzheimer Society of Canada, the first ever Canadian Charter of Rights for people with dementia. And Lillian Hung is a UBC nursing doctoral alumni and clinical assistant professor. She's also a clinical nurse specialist in older adult mental health at VGH and currently an Alzheimer Society funded postdoctoral fellow. She is committed to patient-centered dementia research. So I'll turn it over to you both when you're ready.
Good afternoon. My name is Mario. And 10 years ago, I was diagnosed with vascular dementia, possibly Alzheimer. It is very exciting for me to participate in research that uses technology to help people with dementia.
Hello, everyone. I'm Lillian. It's very exciting for me to do research with Mario together. I like working together. So, do you guys like technology? How many of you have cell phone? Raise your hand. Can you relate to this picture? That could be me before coming here, talking to someone over Twitter before coming into this room. Yeah. So many people really worry about the technology, the robots, that they will replace human and increase social isolation. It's really concerning. But in our research, we find this particular robot, Paro, it not only increased social contact, but it also increased the quality of the social contact. It engages people to have conversations. This is my mom. She has mild cognitive impairment, MCI. The first time she met Paro, she kept patting it, talking to Paro. Oh, hey, you little baby, you want some love? Here you go. She kept talking to the robot and telling me things about the robot. She couldn't stop.
There will be 1.4 million Canadians living with dementia in 2031. And as a result of the Canadian Bill C-233, the National Dementia Strategy was launched. We need to raise awareness, reduce stigma, and educate the public about dementia. The Canadian survey found 50% of Canadians do not believe that people with dementia could live well. 10 years ago, I was diagnosed with vascular dementia and possibly Alzheimer. I stand here before you today as a prime example that with good support, people can live well after a diagnosis of dementia.
This is Paro, a social robot designed specifically for people with dementia. It has artificial intelligence, AI. It has all sorts of different sensors that helps to engage people. Paro has been used in many countries in Europe, Japan, and it has been used over a decade.
I was invited to co-research this project with Paro at the Vancouver General Hospital. Our research team is composed of patients and family partners, occupational therapists, physicians, and nurse Lillian.
So how do we use Paro? A person with dementia came into VGH, the hospital, with acute chronic heart conditions. He won't let anybody go near him. So we were not able to do any diagnostic procedures. So with his permission, I put Paro on his lap. He was talking to Paro, patting it. So the mobile lab came over, and we were able to do the EKG and his blood work. So from our early research experience, that we find the findings are quite similar to other studies that find in long-term care. The robot, it's really non-threatening, and it's good at engaging people. People like talking to the robot or using it for conversations. Patients in the hospital, they do not really know the staff in the hospital, so you can imagine it can be quite scary to meet such a large team of strangers in the hospital. So the robot allows the staff to connect with the person at a personal level, build that relationship. And you can see when people have relationship, then the quality of care improves. We also see Paro was able to reduce stress and anxiety. It works like a pet, like an animal. It melts people's heart and relaxes people. It's not only that it's not always possible to have a pet, an animal in the hospital, but the robot is always available as long as it's fully charged.
These are some of the barriers found from initial research, and one of the biggest challenges is infection control. Lillian worked with the infection control and clinical council to develop protocol for cleaning the robot. Another barrier is the cost of the robot. It cost about $8,000 per unit, and the hospital foundation funded 2 units of the robots. This recent research paper shows Paro is cost effective. Lillian and I took Paro to an Alzheimer cafe meeting, and this is a support group of people living with dementia and their friends and family, students and volunteers. Think of it as a safe place to enjoy a little bit of singing and just enjoy conversations. I was amazed by the reaction of most of the people on our first encountering Paro. It is like handing over a newborn baby to a grandmother. One person initially would not touch the robot, but when I gave it to her husband, she slowly caressed the fur and then started cooing and talking to it.
So another story, Rob is a patient. A staff said, Rob is purple dot. He's aggressive. Don't go near him. Rob is also blind. So I went over there to say hello. The robot Paro leaned on him. So he talked to the robot. He said, "You like me, huh? I can't see you, but I can feel you." So people were really surprised. They went closer to Rob and they started to mingle and said, "What's that thing?" Right? They talk and they laugh. One of the physicians said, "Wow, I see his affection and the person." So that's the magic when it happens, when you see the robot actually makes people more human. In my research, I try to bring people together. We work